Welcome to the second episode of Voices of Care here from the LaingBuisson Private Healthcare Summit in London. I'll be taking this opportunity to speak to more of the speakers and the delegates to see if we can get a consensus about how the sector can navigate the future from both a patient and provider perspective. I'm delighted to welcome Sim Scavazza, Acting Chair at Buckinghamshire, Oxfordshire and Berkshire West ICB and Non-Exec Director, Imperial College Healthcare NHS Trust. Sim, thank you very much for joining us on Voices of Care today.
My pleasure.
Now, you were one of the expert members of the panel looking at the crucial issue of recruitment and retention in the workforce, and particularly to shed light on what's going on in the NHS workforce as a barometer for the rest of the sector. The NHS People Plan has been around for a while. Inclusion, compassion are very, very important. The NHS staff survey perhaps could be better. I just wanted you to shed some light on what you shared at the panel around those issues.
Well, it's so prominent at the moment because, of course, it's all part of the retention, as you say, kind of strategy. We've got to look after those that are already working for us, as well as pulling in new people. So when it comes to looking after our staff, apart from all the well-being, it's that feeling of belonging, and it's that feeling of then, once they are in the organisation, are people listening to them? Is it safe to talk up if there are issues or there are concerns? And it's building a place where people feel safe enough just to be honest and true. So that whole inclusivity piece is becoming more and more prominent, especially after the Messenger report in 2022, where they identified inclusive leadership as a key proponent of all boards, all senior executives, all chairs and CEOs kind of, values and behaviours. So it goes without saying, there's a huge number of people within the NHS that are from an ethnic minority. And, we have different cultures, we have different ways of thinking, different ways of eating, and that all needs to be accepted and understood for a better environment.
Absolutely. And are we seeing, this has been something that, having spoken to many leaders, they're very passionate about, including yourself. Are you seeing that now being embraced more and in practical implementation on the ground? Because that's the key, isn't it?
You're absolutely right. So it's that impact that we're missing. So we've got the data, as you say. So what I can see is pockets of progress being made, either in some different trusts or in some different ICBs, but as a whole, it's still glacial. The good news is there are more ethnic minority NEDs, non-exec directors, on boards than ever before in the NHS. The bad news is there isn't the diversity within the executive, and there lies the issue. So, it's a load of people that have come up through the ranks. So we've got to break that cycle. That's the bit that everyone's concentrating on.
And that's part of a broader approach that you talked about on the panel in terms of being holistic and also looking beyond the silo of the NHS, social care, independent sector, a systems approach. Collaboration is in the zeitgeist. Are we seeing ICBs embracing or being open to going beyond the borders and collaborating with private providers on workforce and broader provision?
So it's part of the ICB's remit. It's their reason of existing to collaborate and work together. Now, you must appreciate this is quite difficult, isn't it? This is not the way the NHS have been brought up to think and to act and to operate. So we're asking a lot. It's a big cultural change. But there are ICBs that are much further on in their development than others. And I can say, we are seeing instances of this. We are seeing instances of the NHS working with local authorities. And of course, when you work with local authorities, therein lies the adult social care. We have our into children. Also working with the GP network, that is our, if you like, the golden thread. That's the connector to our population. So we can see ICB starting to gain traction in this, but it's not easy, and everybody knows that. And we need to be persistent in order to do it. And it's complex. Different regions have different relationships with different partners, and there are multiple stakeholders that need, I suppose, educating in the new way, and lots of people don't trust the NHS.
No, and we've got the long-term plan vision now we're seeing more complex hospital-style care being delivered in the home, in the community, and that's, I think you're seeing that across the system that you work in.
Absolutely. I said on stage today that we were looking at 750 virtual ward beds, the equivalent of 750 beds in the community, using a multi-agency approach. So that's everyone from the social care system all the way through the consultants, the community nurses, an extra 750 beds. That's amazing for us. And this is part of the remit in terms of prevention, in terms of promotion of health and well-being outside of the acute setting. And this is really, really important. So it's very exciting.
It's fantastic, exciting. One final point, of course, to deliver the care in virtual wards and to deliver the systems approach in community, we're going to need more workforce, greater productivity. And I think one of the key things that you were speaking about and the others were, is we need a disruptive, technological, digitally enabled approach to training more people to enter the workforce.
Exactly. We've got to be less precious, I think. We've got good people in social care. We need to create routes for them to become either a registered nurse or an HCA or anything that will help, look after our patients. So we've got to be innovative and we've got to be brave and a bit courageous. But there are enough people in totality, but we need to recalibrate and reorganise the way that they are, contributing, if you like. So if we can get to that point, there's great hope. As someone said today on the panel, there aren't more, people in the world in order to come into healthcare. So we've got to use better those that already are here.
So we're all going to wait with bated breath for the workforce plan.
Yes, but in the meanwhile, systems, trust are getting on with it. We have to.
Absolutely. Thank you very much for your time as always. Look forward to seeing you again. Thank you, Sim. I'm delighted to welcome Michelle Gorringe, Chief Operating Officer at Newcross Healthcare, to join us for this Voices of Care podcast. Michelle, thank you very much for your time.
Thank you, Suhail, for inviting me.
It's a very vibrant summit looking at the private healthcare sector, but looking more broadly, there was a panel that you were on as an expert looking at the crucial issue of recruitment and retention. And it's clearly a factor, not just for the NHS, but across all of health and social care.
Absolutely. It's we're caught in a vicious circle that we really need to break. And it was very clear with the messages from the panel that we've all got very strong ideas on what we would like to do, but it's just really getting things done and changing this current situation.
And the panel spoke a lot about tools that are available now, a more inclusive leadership, compassionate, safe space, etc. But there was a clear recognition that we've got a finite resource at the moment. And I think your point was that actually we need to turn the dial, look a bit differently, and expand the workforce through really a revolution in training and pathways to training. Can you expand upon that? Because it's a very personal mission for you.
It really is, and it's about dialing up. It's about dialing up. It's about particularly looking at the sector for all individuals as a potential for career. And it's giving that message out to the wider public that the sector is full of opportunity. At the moment, the conversation is, of course, it's around shortages, it's around all of the workforce issues that everyone is facing. But we have to change in some respects. We have to change that mood. And for me, nursing, I've been in healthcare now for 40 years, and I qualified as a nurse. It was my ambition and my dream to qualify as a nurse. I had a wonderful aunt. I still have a wonderful aunt who is a nurse, and she really, by example, showed me what a difference you can make when you take care of someone. It was actually my grandfather. He was very poorly. I was 14 years of age, and he was dying of cancer. And my aunt was the only one that could make him comfortable, and it was just her gift with his pillows. I call them the magic pillows, that she could make him comfortable give him the support that he needed, and really support the family through that whole horrendous journey that we went on when he was dying. And that, for me, when I watched her, I was just inspired, and that's why I went into nursing. But I could go into nursing at the time because we received a small wage, 96 pence an hour, and we lived in the nurses' homes for very low rent, so it was £11 a week. So I could afford to go into nursing to chase my dream, really. And here I am 40 years later. But that's not the case, unfortunately, for the modern day nurse. They leave their education with crippling debts. And that is a huge barrier of entry for many people. They just can't afford to do that.
And we need more nurses now than ever. And it was that personal and professional journey which I think has led you, as you shared on the panel, to have a completely disruptive approach and over the last few years offer that route.
Absolutely. I'm a great supporter of the nursing apprenticeship. I think that it's going to give a whole new line of opportunity for people that have that barrier, that financial barrier, but also that they learn better on the job. So I'm actually a big advocate of that as a support structure to the graduate nursing. I believe that nursing as a whole, the whole education should be completely free. I think all education should be free. I think it's really important to recognise that education is a fundamental requirement for an evolving healthcare service. Better patient outcomes, also career opportunities for individuals. So we at Newcross, just over 3 years ago, we made a commitment that all of our education would be free for all of our nurses and our healthcare staff. And it was just overwhelming, the success that this has been, that our nurses just embraced the opportunity, our healthcare staff embraced the opportunity. Last year alone, they undertook over 250,000 courses, which is just phenomenal. And of course, by taking the courses, they were improving their skills. They were also improving the patient outcomes. But in addition to that, they were starting on new pathways of opportunity with development. So because it was so overwhelming and such a success, we decided to form Future U. Future U is a standalone education business. And the key core principles is that we will democratise the whole education sector for healthcare. We will make sure that healthcare is education is attainable by everyone. So zero cost to anyone that wants to undertake whatever training they want to undertake. That's not just for Newcross staff, that's for anyone that's already in the sector or is inspired to look at the sector as a career.
So it's a truly global approach. We have 10 million healthcare workers that we're going to likely to be short of globally. And the Future U ambition is not just for the UK challenges, you're democratising this for anyone and across the global healthcare system.
Absolutely, yes.
Free of charge.
Free of charge. Free of charge. It's really exciting.
It's unbelievably exciting. One final quick point I wanted to talk about that came out from the panel was this idea of collaboration. The NHS sits here, normally the independent sector sits here, and we saw some encouraging comments from Sim Scavazza, for example, saying that the NHS is now perhaps beginning to turn a dial to collaborate with private providers. Clearly something that you're keen to see.
Absolutely. It can't come soon enough. We're not in competition with each other. We should be working together in that collaborative approach. The benefit will be, of course, better outcomes for patients and the whole healthcare service as a whole. So for me, I just can't wait to see that happen.
Well, let's hope that policymakers are listening. Thank you for your time, Michelle, and have a brilliant rest of the summit.
Thank you very much.
My pleasure. My pleasure.
Bye-bye.
Delighted to welcome Dr James Frater, social entrepreneur, back from India and the G20 Y20 summit. And James, thank you very much for giving your time for the Voices of Care podcast.
It's a pleasure to be here.
The summit is looking at a number of things, including the human aspect on a panel around retention, recruitment. You're speaking on that panel and are going to focus on changing perceptions around healthcare. Can you expand a bit on that without giving everything away? Because, of course, the panel is due to start shortly.
Yeah, no, I'd love to. So I think in the context of this panel, right, particularly on the focus on humans, I think it's really important to really understand like what is important to the people, right, the actual humans in the workforce. And I think there hasn't been enough of a focus on like things like psychological safety. How do people feel coming to work? Do they feel safe? Do they feel like they can speak up? Do they feel like they can bring forth ideas even when they might not be the person in charge of like a particular thing? Do they feel like they can kind of bring their whole self? And I think I really want to explore how we can make that happen in a way that's on a systems level rather than kind of individual like places or individual people, and how do we make sure it's sustainable so that this continues without any one individual kind of driving this forward.
And that's really important because we're talking around shortages in the workforce. Everyone's talking about how we're going to grow the workforce. But if we're a leaky sieve with people are leaving, and you know the numbers, of course, as a doctor yourself, people are leaving the sector. So that psychological safety, that ability to speak up, that's a big cultural point. And the NHS staff survey has been challenging, to say the very least. Yep. So the role, I think, of compassionate and inclusive leadership is going to be really important there?
Yeah, definitely. I'm not sure how much I can talk about it, but I'm actually doing some research looking at how do we build infrastructure that allow people to become more compassionate leaders, but also allows them to lead in a way that is truly inclusive. Also looking at another piece of work around training. How do we train people to, from very young, but very early in their training, how do we make sure that they are operating in a way where, one, they feel psychologically safe, but two, in a way that allows them to be the most compassionate and the most safe kind of clinician they can be, because currently it's really difficult.
And that training point you make, it's not just a question of university, but the pools of people that we're going to entice into the health and social care sector. There needs a bit of a innovation in terms of training and giving different pathways, because people come from a wide variety of socioeconomic, demographic factors. I guess that's an important issue for you, to democratise access to that training.
Absolutely. I think we already see some steps being taken with this introduction of, it's going to be like an apprenticeship style sort of pathway for doctors. I think that's one way to sort of democratise access to like these professions. But I think it goes back to the key point around building infrastructure that allows people to feel valued, but also feel like they can progress in a way that suits them, their skill sets, and the value add that they can bring to the organisation or the system.
And the broader issue, which has been around for a long time, again, the NHS staff survey and across all social care sector as well, truly inclusive culture. There's been some great work done, but we've got a long way to go.
Definitely. Again, I think especially since 2020, there's been a lot of efforts to kind of make workforces, generally speaking, but particularly in healthcare, more inclusive, more diverse. But then I'm not sure we're there infrastructurally for a number of reasons. But yeah.
And are you seeing more and more people who are representing the diversity of the workforce, a rich diversity in the workforce, in more leadership positions? Have you seen in your time just the beginnings of some change there?
Yeah, so I think the challenge is, and it's been reported, and there's loads of studies around the fact that there's loads of diversity, particularly in entry-level roles, right, and allied health professional kind of roles. But I think as you move further up the kind of leadership chain, you find that diversity starts to diminish, and I think that's partly to do with, as I mentioned before, the infrastructure thing. But I think there definitely needs to be more like, we spoke about like innovative, but also like a real conscious effort to make sure that it's not just like tokenism, like we were just putting people there because it looks more colourful, for example. But I think, how do we make sure that we're doing this in a way that it adds real value to organisation, whilst also making sure it's truly inclusive for the people who are getting into these leadership positions, right? Because you want to make sure that when they're there, they're actually able to do their best work. And I think currently the positions are becoming more diverse, but the infrastructure isn't there to make sure that they're supported enough in order to do their best work.
And that's going to be really important. The theme on the summit here is navigating the future, and that is a topic I think was big on the agenda. You've just come back from India and the G20. Can you tell us a little bit about that? Because you were speaking around health and well-being and very much the future in terms of the younger generation on all of these topics. What perhaps are the 2-3 key things that you learned from that? It must have been an amazing trip.
Yeah, so first kind of explain the role. So I am currently the UK G20 Youth Delegate for Health, Wellbeing and Sport. So as a result, I'm going to be creating policy for the Youth G20 that represent all the young people in the UK. And so at the summit, we explored a number of things around like house financing. How do we make sure that people have access, equitable access to telehealth, for example? How do we make sure that people have help with mental health and all these things? And I think a couple of challenges is how do we truly make digitalising healthcare truly accessible and truly equitable, and that was one of the challenges that we kind of face, particularly on like a policy front. So I was looking at, is there scope for like private-public partnerships? How does the private sector play a role in making sure that society is more equitable, but also like how do we tackle the real challenges? For example, like a big portion of the world doesn't have access to stable internet. That should be a fundamental right, particularly in this digital age. We should have everyone should be able to access the internet, because that's a huge leveler for so many people.
You've taken on quite a big topic, the challenge, and I wish you all the best. But thank you for giving us your time and insight today, and look forward to hearing you on the panel.
Thank you so much. It's a pleasure to be here.
Pleasure. Thank you.
Thank you.
It's been a great day here at the LaingBuisson Private Healthcare Summit, and I hope you've enjoyed both the episodes. And I'd like to take this opportunity to thank all the guests for their time and their wisdom. This is a wrap-up not only of these episodes, but actually of Season 1 of the Voices of Care podcast series. And it's been a personal privilege for me to share time for people and leaders right across the healthcare spectrum. Sir Julian Hartley, Sir David Nicholson, Jane Townsend, Professor Camilla Hawthorne, to name a few, Justin Ash. And the series, when we started this, the goal was to really be able to ask questions, highlight the challenges certainly, but give a platform for people who are innovating, doing things differently. The great care that's been given, points of light as Ian Trenholm described them. The whole series is available wherever you get your podcasts, and if you've liked this episode of Voices of Care, please follow, like or subscribe wherever you receive your podcasts. And if you want to know how we are truly transforming and enabling the healthcare workforce of the future, please visit newcrosshealthcare.com/Voices of Care. In the meantime, I'm Suhail Mirza. Goodbye and thank you.